Hello, today we're going to talk about joints within the shoulder. Now, the shoulder complex is an intricate system that includes several joints, each playing a really critical role in allowing the wide range of motion necessary for upper limb function. Now, we do have the glenohumeral joint, but today we're going to discuss the other joints, the acromioclavicular, the AC joint, the sternoclavicular, the SC joint, and the scapulothoracic joint, ST joint. And here's a closer look at each one. So the acromioclavicular joint, the AC joint, is a synovial plane joint. Now, the AC joint is located where the clavicle meets the acromion, which is a bony projection off the scapula. Now, this joint is a key player in the movement of the shoulder, particularly in overhead motions. Now, the AC joint allows the scapula to rotate and move, which is essential for raising the arm above the head and for other complex movements. It also provides a degree of flexibility to the shoulder girdle, aiding in the overall mobility of the upper limb. Now, the AC joint is stabilized by a series of ligaments, including the acromioclavicular ligament and the conoid and trapezoid ligaments. These ligaments help maintain the alignment of the clavicle and scapula during movement. Now, common injuries we see in the AC joint, such as sprains or separations, are common in contact sports and can occur due to falls or direct blows to the shoulder. Now, such injuries often result in pain and limited shoulder mobility. Now, the sternoclavicular joint, the SC joint, is the point where the clavicle meets the sternum. This joint acts as a pivot point for shoulder movements, particularly for the clavicle's motion. Now, the SC joint is the only direct bony connection between the upper limb and the axial skeleton, and it allows for movements such as elevation, depression, protraction, retraction, and rotation of the clavicle, which are all necessary for full shoulder girdle mobility. Now, the SC joint is supported by several strong ligaments, including the sternoclavicular ligaments, the costoclavicle ligament, and the interclavicle ligament. Now, these ligaments help secure the clavicle in place while allowing a wide range of motion. Now, dislocations of the SC joint are rare, but they can occur due to trauma. Now, such dislocations can be anterior or posterior, with the latter being more severe due to the proximity of vital structures like blood vessels and nerves. Now, the scapulothoracic joint, the ST joint, is not a true anatomical joint, as it does not involve a direct bone-to-bone connection. Instead, it refers to the articulation between the scapula and the thoracic wall, so the rib cage. Now, the ST joint plays a vital role in the smooth movement of the scapula across the rib cage, which is essential for shoulder elevation, depression, protraction, retraction, and rotation. Now, this movement is crucial for activities such as reaching, lifting, and throwing. Now, the stability at the ST joint is provided by the surrounding muscles, including the trapezius, the rhomboids, and others. Now, these muscles coordinate to control the position and movement of the scapula relative to the rib cage. Now, dysfunction at the ST joint can lead to scapular winging or problems with scapular movement, where the normal movement of the scapula is disrupted. Now, this can result in pain, weakness, and impaired shoulder function.